Hello, Dr. Williams. I hope you're doing well. I want to say thank you for allowing me to do this test out option. This video will address prompt 1. So the first question was about finding differences between two particular theories. So I'm going to address some differences and similarities between person-centered therapy and between cognitive behavioral therapy. Then I'm going to mention ways that may influence my work, how multicultural feminist considerations can be applied to the two theories, and also my favorite and least favorite aspects of those theories. So to start out with a brief description of each theory, person-centered theory is very non-directive, whereas cognitive behavioral therapy, much more directive by the therapist. Person-centered has a very humanistic worldview, looking at human beings in a positive light as if they're moving toward growth, whereas cognitive behavioral is going to be more of a scientific worldview. And person-centered therapy has an emphasis on listening, reflecting, and internal processing, whereas cognitive behavioral has more of an emphasis on interventions and external changes. So that's where we'll see a lot more taking inventories and seeing a quantifiable number of where a person is and applying a certain studied intervention and then taking another quantifiable assessment at the end and seeing where a person might be. So a bit more of an emphasis on some external changes. Each theory has already influenced my work and will continue to do so. Person-centered therapy has influenced it in foundational ways, not just in my interactions with clients, but with colleagues and other people in the field. I can see it influencing my qualitative research quite a bit because any good listening and reflective listening and open-ended questions are going to be really helpful for the research that would be involved, the interviews that would be involved in qualitative research. And I know that the humanistic worldview that is behind person-centered therapy definitely has influenced my career in the sense that it has provided a great optimism, which is both my best quality and probably my worst, that I often really believe an intervention is going to work for a client, and I think that can be helpful. There's times, though, that that's a liability in the sense that I have so much optimism that I can collude with families to overlook some dark family secrets. For instance, intimate partner violence is difficult for me to assess because I often assume if it doesn't get brought up that it is not occurring. And I realize that has to do with a kind of humanistic bias, and that's something that I'm working on. Cognitive behavioral therapy has influenced and can continue to influence my work in the sense of being a platform for many clients. So having a specific intervention that can work for a specific problem is a huge relief. Seeing them find relief by doing something like some progressive muscle relaxation for anxiety or some behavioral activation for depression has been really foundational to get them some space within their life to work on the deeper issues that have brought them into therapy. I believe it's also been very useful in some psychoeducational opportunities I've had because then again we're using proven techniques and proven ways of communication. So I've gotten to do some things like teaching parenting classes or teaching relationship skills classes, and those are very cognitive behaviorally based, looking at some interventions that have been studied and found empirically to be helpful to a large group of people. I also believe that cognitive behavioral therapy and its concepts would help me to be a better quantitative researcher because it would push me to be more data driven and more empirical. Multicultural and feminist perspectives can be applied to both. Starting with person-centered therapy, it would be really helpful to as we're listening to a client to also really tune into things that they're sharing about their culture, not just about their individual experience. And so even when we're thinking that person-centered therapy is just about following the client's lead and really reflectively listening, we still, with our nonverbals and with our encouragement, can really show to them what we're interested in their world. And I think that's an opportunity for us to really show great interest and to ask curious questions and to really reflect things that they're talking about, their cultural worldview, not just their individual experience in the moment. It can also seem, person-centered therapy can also seem overly intense to some cultures. For instance, a culture that is more collectivistic and not used to that individual listening. And so being aware of that could have a lot to do with the way it's implemented. Things like if a person seems to be averse to eye contact, matching nonverbal behaviors with theirs, being willing, even with a client that's not a child, to do some typical play therapy oriented interventions like drawing or playing with kinetic sand or something as we're talking, because that gives a way to focus away from the intensity of eye contact. There are some multicultural considerations certainly to be applied with cognitive behavioral therapy as well. One, that it can be a very hierarchical type of relationship, and for some clients and some cultures that's really going to be what's expected. They often let you know by their language, like, we're here for some advice, that might be a real expectation. However, there could also be a hierarchy that could be harmful, that it could seem as though these interventions and things that the therapist knows about, that because of the therapist's status as an expert, there could be a kind of a disconnect where, rather than really trying to flatten that hierarchy, we could play into it. And so that would be something to really watch out for. A primary way that I have tried to watch out for that and want to do more of in the future is by being very responsive when we talk about any type of homework assignment, and really listening. Number one, not really calling it homework generally, but listen to their perspectives about, check in as an assignment might be given, rather than say, hey, why don't we try this? This will be a really great idea. But saying, for some people, an intervention like writing down some of your thoughts can be helpful. How does that feel to you when we talk about doing something like that? What are some thoughts and feelings that come up? So really trying to take some of the cognitive behavioral techniques, but apply them in a culturally sensitive manner. So I'll speak for a minute about some of the things I like most about each theory and some of the things I like least. For person-centered therapy, I really like that it's very intuitive to me. So I can understand for each therapist that's probably very different, but it comes very intuitively to me to listen and to reflect and to kind of let the client lead the direction that we go in goal setting and within particular sessions. I believe that it's also very simple and not easy. I don't want to confuse those two terms, because it's not easy to listen to people with that intensity and on that level. But at the same time, it's a simple technique, and that is very helpful to me, that there's not a list. It's not like solution-focused brief therapy where you might be trying to remember the acronym in the back of your mind for the next step. This is a simple, again, not easy, but a simple type of intervention to follow. I also believe that it translates easily from the therapy room into real life. And what I mean by that is the way that I'm listening to a client would be something that they could easily emulate and listen to others in their life in a similar fashion. There are some things that are liabilities about it, of course. It can seem goalless at times. It can seem as if, because we're following a client, particularly if that client is having a difficult time determining their goals, it can seem like we just kind of move around in sessions and don't really have a case conceptualization of where we're trying to go. And it can also sometimes violate a client's expectations. As I mentioned when I was talking about a multicultural perspective, there are some cultures that really expect us to have much more of a directive approach. And there also are just particular instances in which a client needs us to have a more directive approach. For instance, if a person is really dealing with panic and they're saying, I don't know what to do about this next panic attack that may be coming. I really need some help. I really need some steps, and I need some tools. It doesn't feel right to me then to say, so you're really stressed out about your panic attacks and you wish you knew what to do about that. It feels like I should do something quite a bit more concrete and helpful in that situation. So moving to some of the things that are most appealing and least appealing about cognitive behavioral therapy, some things that are very appealing about it are its empirical scientific base. There's so much proof that cognitive behavioral principles work. And so it's very relieving to know when we're working with somebody that we've got some things that have been really looked at closely and validated in peer-reviewed journals, that this is a good intervention that can work for this particular problem or issue. It can work really well with short-term therapy, which is often needed, and it can provide some confidence, especially to new therapists. In doing supervision, I've noticed that new therapists really like cognitive behavioral techniques because they like to feel like I know what to do next. Then that leads us right into some of the liabilities, though, about cognitive behavioral therapy, that sometimes we can have a tool and just be looking for a place to apply it. I had one supervisee that really believed in journaling, and at any given point, there would always come a time when she was talking about a case where she had the person journal. And journaling is not a bad intervention. It can be really helpful. There's a lot of proof that it works, but it also seemed to be applied sometimes in a non-responsive way, in the sense that sometimes we feel so confident about a technique that we're going to apply it regardless of the situation. And that's one of the things that concerns me about cognitive behavioral therapy. Thank you again for taking the time to listen to my response to this prompt.